Hey there, health enthusiasts and curious minds. Have you ever heard of a condition that makes people sleep for days or even weeks at a time? It might sound like something out of a fairy tale, but it's a real disorder called Kleine-Levin Syndrome, or KLS for short. Some people call it the Sleeping Beauty Syndrome. And today we're diving deep into this rare and puzzling condition. So grab your coffee, you might need it, and let's explore the world of Kleine-Levin Syndrome together. First things first, what exactly is Kleine-Levin Syndrome? KLS is a neurological disorder that mostly affects teenagers and young adults. It's characterized by recurring episodes of excessive sleep, usually lasting from a few days to several weeks. During these episodes, people with KLS can sleep for up to 20 hours a day. But it's not just about sleeping. KLS also causes changes in behavior and thinking. Let's break down the main symptoms of a KLS episode. Extreme sleepiness is the most obvious sign. People with KLS might only wake up to eat or use the bathroom. When they are awake, they often seem confused or out of it. Some people with KLS eat a lot more than usual during episodes. Others might show increased sexual urges or behaviors. Mood changes are common, with some people becoming irritable or withdrawn. Now you might be wondering, what causes this strange condition? Well, that's the million-dollar question in the medical world. The exact cause of KLS is still unknown, but researchers have some theories. One idea is that it might be related to problems in the hypothalamus and thalamus. These are areas of the brain that control sleep and appetite. Some other potential factors that might play a role in KLS include genetic predisposition. KLS sometimes runs in families. Infections. Some people develop KLS after having the flu or other infections. Autoimmune response. The body's immune system might be attacking the brain by mistake. Hormonal changes. Since KLS often starts in teens, hormones might be involved. Let's talk about how doctors diagnose KLS. It's not an easy task because KLS is so rare and its symptoms can look like other conditions. Doctors often start by ruling out other disorders that cause similar symptoms. They'll ask about medical history and family history of similar issues. Sleep studies might be done to check for other sleep disorders. Brain scans like MRI or PET scans can help rule out other neurological problems. Keeping a detailed sleep and behavior diary can be really helpful for diagnosis. Now, imagine you or someone you know has just been diagnosed with KLS. What can be done to manage this condition? Unfortunately, there's no cure for KLS yet, but there are ways to cope with it. Here are some strategies that can help stick to a regular sleep schedule, even when not having an episode. Try to identify and avoid triggers that might set off an episode. During episodes, make sure the person is safe and their basic needs are met. Some medications might help reduce symptoms or prevent episodes. These could include mood stabilizers, stimulants, or anticonvulsants. But remember, medication effects can vary from person to person. Therapy can also be a big help for people with KLS and their families. Cognitive behavioral therapy can teach coping skills for dealing with the disorder. Support groups, either in person or online, can provide a sense of community. It's important to remember that KLS episodes usually become less frequent with age. Many people eventually outgrow the condition, though it can take years. Let's hear what some experts have to say about KLS. Dr. Sarah Thompson, a neurologist specializing in sleep disorders, emphasizes the importance of early diagnosis. She says,
Kleine-Levin syndrome is not just a sleep disorder, it affects the entire life of the patient. Early diagnosis and a tailored management plan are crucial in helping patients maintain their quality of life.
Dr. Michael Reed, a psychiatrist experienced in treating KLS, points out the emotional toll of the disorder, saying,
The unpredictable nature of KLS can be overwhelming for both patients and their families. It's important to address not only the medical aspects, but also the emotional and social challenges that come with the disorder.
So what does all this mean for people living with KLS? Living with KLS can be challenging, but it's important to stay hopeful. Research is ongoing, and our understanding of the condition is always improving. With the right support and management strategies, people with KLS can lead fulfilling lives. It's crucial for family members and friends to be patient and understanding. Remember, the person with KLS isn't choosing to sleep excessively or behave differently. And there you have it, folks. a deep dive into the world of Kleine-Levin Syndrome. It's a complex and mysterious condition, but knowledge is power. By understanding KLS better, we can support those affected by it and push for more research. If you found this video helpful, please give it a thumbs up and share it with others. Do you know anyone affected by KLS? Share your experiences in the comments below. And don't forget to subscribe for more videos on rare and interesting medical conditions. Until next time, stay curious and keep learning.